Welcome back to Quick Minute Bites. Today we'll quickly revise about the ABG interpretation. This is one of the very important videos. I want every student to know about the ABG analysis, because if you posted in a medicine ward during internship, almost every day you go for ABG analysis. So before talking with PG, I want every student to analyze by themselves. So we'll see the normal values here. pH 7.35 to 7.45, PCO2 35 to 45. Then bicarbonate, which is 22 to 26 milli equivalent per liter, and oxygen is 80 to 100 mmHg. These are the four important values you must know, you must remember. Then SpO2, every student know that 95 to 100%, and lactate 0.15 to 1.6. Okay, next anion gap 12 plus or minus 4, which is 8 to 16 milli equivalent per liter. Okay, now I want you guys to remember a trick called ROM. ROM, R is equal to respiratory. So respiratory is equal to opposite, and metabolic, M. Metabolic is equal to equal. Okay, so for example, we can see if pH is low and PCO2 is high. Okay, low, high. So we call this respiratory acidosis because pH is low. So acidosis. If pH is high, this is alkalosis, plus PCO2 is low. So two different direction, respiratory alkalosis. Okay. If pH is low and bicarbonate is also low, so both are low. So this is metabolic. Metabolic is equal to equal. So both are low, metabolic acidosis. pH high, bicarbonate is also high, so which is metabolic alkalosis. Understood, guys? So we'll see what is anion gap also. Anion gap is something amount of unmeasured blood present in our body. We need to know how much unmeasured blood is present in our body. If the anion gap is more unmeasured acids. So there are two types in anion gap. HAGMA. What is HAGMA? High anion metabolic acidosis. Mostly seen in age more than 12. Okay. NAGMA. NAGMA is normal anion gap metabolic acidosis. This is mostly seen in age group around 8 to 12. In HAGMA, high anion gap is equal to more acid. Okay. So in NAGMA, high anion gap. In NAGMA, normal anion gap. So normal acid, but bicarbonate is lost somewhere. Okay. So the first one is metabolic acidosis. Metabolic acidosis means pH is also low and bicarbonate is also low. We have two types in this, HAGMA, NAGMA. HAGMA, high anion gap metabolic acidosis, right? In HAGMA, we can see diabetic ketoacidosis, which is due to hyperglycemia. Then we can see uremia, which is due to more blood urea nitrogen is present. Next, we can also see drug injections like salicylates, isoniazid, such things. And we can also see due to propylene glycol, ethylene glycol, and methanol. And the most important one, also lactic acidosis. Okay, in this DKA, lactic acidosis, and uremia, methanol. These four are important things. Next, NAGMA. In NAGMA, you can see renal tubular acidosis and the diarrhea patient. Okay, diarrhea is coming under what? Metabolic acidosis, NAGMA. And acetazolamide, which is a carbonic anhydrase inhibitors. Then ureteral diversion, example ileal loop. Next, we are going to see about metabolic alkalosis. Okay, which is pH is high, bicarbonate is also high. In metabolic alkalosis, in acidosis we saw diarrhea. So in alkalosis, vomiting is coming, NG tube suction is coming, and patients who are taking more diuretics diuretics, and diuretic patient mostly will come to hypokalemic state, and they also will come. Also antacids. So now the third one is respiratory acidosis. Respiratory acidosis means pH low, PCO2 high. In this you can see acute respiratory acidosis like airway obstructive disease, asthma, acute exacerbation of COPD, severe pneumonia, those are comes under that, and chronic respiratory acidosis which are COPD, obstructive sleep apneic patient, poorly ventilated patients, they are come under chronic respiratory acidosis. Next one is respiratory alkalosis. pH is low, PCO2 is low. Hyperventilated patient, hypoxia, stroke, anxiety, panic attacks, these are comes under the respiratory alkalosis. I hope you guys understood the video. Subscribe for more videos. Bye bye.